we're very pleased to see that older adult malnutrition and sarcopenia were included in the guidelines that were released recently. We are very pleased to update our national blueprint, Achieving Quality Malnutrition Care for Older Adults, which has gotten a fair amount of circulation around the country. We're very proud of that fact. And returning to Meredith.
All right, so now we're recording, but, for anyone who's tuning into this recording starting now, all you missed was our 2020 highlights. So you will get the full policy agenda. So also in 2020, we launched the COVID-19/malnutrition informational website. It's defeatmalnutrition.today/COVID-19. There's a link from our homepage as well. And that has received over 2,000 views at this point, which we are really proud of. That's pretty remarkable for our little website. So with that, we'd like to make 2021 another successful year and build on the progress that we've already made. We're interested in a few key areas this year, including adoption of the Malnutrition Composite Electronic Clinical Quality Measure, which is quite the mouthful.
And as I mentioned earlier, with the enactment of the Older Americans Act of 2020 into law, now we are working with the administration on the implementation of the Older Americans Act, particularly the provisions on malnutrition, for first-time malnutrition screening, and then also adding reducing malnutrition as a purpose of the nutrition programs in the Older Americans Act. And obviously, since we are still in the throes of the pandemic, we are aware of the increasing amount of need for emergency funding for nutrition programs, particularly those for older adults. And we expect to be very active in that space, working with colleague organizations to ensure that those needs are met through emergency funding. But we also plan to cover a lot of other ground as well.
As you will see. So first up, first and foremost for us right now is the Malnutrition Composite ECQM. We and other organizations have already submitted comments to the measure application. I think it's partnership and not process. Sorry, that's my typo. Which received a recommendation from that panel conditional on National Quality Forum review and recommendation. So the next step is that the NQF will review it this month, and we will submit comments there. And, in this process, we'd really like to thank the Academy and Avalier as measure stewards for shepherding the measure through this process and giving all of us advocacy instructions. So very much appreciate them letting us be a part of this process, frankly. And, we're also going to, after the NQF review, have some advocacy with CMS involving you guys, our members, and potentially involving some of the Senate co-sponsors or other interested members of Congress.
And I would add that, we are feeling more confident this year than in previous years. A lot of hard work has gone into it, as Meredith mentioned, from the Academy of Nutrition and Dietetics, and Avalier and other advocacy groups. Because they've made a more effective case, we feel pretty confident. However, we need to at least think about the possibility that if this does not occur through the regulatory process, we might have to seek a legislative approach to ensuring quality measures are included from CMS. And then going to Older Americans Act implementation, as we mentioned, the adding malnutrition screening to the definition of nutrition screening and adding preventing nutrition to the purpose of the act. Let's talk about that from the standpoint of we would like to see, as part of this process, two things. One, we want to keep the process flexible. We've talked to the administration. They will not be imposing any particular standard in the malnutrition screening, but they should be encouraging those that are out there that are working to be used. But also, we would like to see in this process us emerging with a standard definition of malnutrition included in future iterations of the Older Americans Act and the implementation of this law, and also a standing definition of sarcopenia.
Yeah, and we understand that it's hard to secure a definition of malnutrition, that there's a lot of clinical disagreement on that, so that may or may not be possible. But at the very least, we would love to see states, picking up the malnutrition screening because, ACL is not able to mandate a particular screener, and that implementation is up to the state. So if you have any connections with your state OAA nutritionist, I would get on the phone. We're also working to have malnutrition screening questions added to the National Survey of OAA Participants. That would capture some data on OAA participants with malnutrition, and the survey has a control group, so there would be the opportunity to see, if non-participants have higher rates of malnutrition, which is, of course, a big question.
And one of the reasons that we have such an interest in capturing data, because first of all, it makes the advocacy process much easier, but also we have an overriding interest in making sure that in malnutrition and in screening and prevention that we are reflecting equity. We want to make sure that access is available to everyone who needs it. We hope data can help prove where we're coming short relative to equity, and we intend to work closely with the administration on this in the coming year. And then we'll move to federal funding now.
So FY22, which is hard to believe, but funding for federal fiscal year 22, advocacy starts as early as this month. We're going to be filling out forms with congressional offices on various funding suggestions, working very closely with our members to make sure that we are aligned with our requests. And later, we should see the president's budget proposal, which is going to be a little later this year because, it's a new administration. So that should be very interesting to see what kind of a benchmark is set by that proposal. And as I said, we expect to be working really closely with you all on funding requests for numbers for the Older Americans Act nutrition programs, for USDA nutrition and research programs, and other important related funding.
And in the meantime, as we continue to deal with the pandemic, there is now another emergency funding bill, a COVID-19 funding bill, that has emerged. The president has put forth his proposal, a $1.9 trillion proposal. Just over the weekend, a group of Republican senators came up with an alternative proposal, about one-third the size of the president's proposal. So now they're in discussions. There was a meeting last night at the White House with those senators and the president. But in short order, and I mean as early as perhaps this week on the House side, they will start moving on a emergency funding bill. And as we have been doing, again, in conjunction with other organizations, we'll be working to make sure that emergency funding is provided for those key federal nutrition programs, which are really going through tremendous growth in need, programs like the SNAP program and the Older Americans Act nutrition program. So we feel as a coalition fighting malnutrition, we've got to be supportive of as much funding for nutrition programs as possible.
So, sorry, dropped the phone there. So as Bob was saying earlier, we are very pleased with the adoption of the Malnutrition Awareness Week resolution by the Senate. And we plan to work with Aspen and others again this year to get further formal congressional recommendation for the Malnutrition Awareness Week in 2021. We wanted to give you a quick list of the 2020 co-sponsors. I won't read off all these names, but just know that all of them except for Senator Roberts, they are all back. They're all still here, and we will continue to work with them.
And if, we've been in touch with every one of these senators at the time they co-sponsored the resolution. If you see your senator, if you're from a given state on this webinar, and you could use the opportunity to start up a new session to thank them for their previous support and look forward to working with them on related issues in 2021. And before we leave Malnutrition Awareness Week resolution, let me take a special moment to salute our friend and colleague Peggy Hunter, who is more or less retiring from Aspen, but she is the individual responsible for creating the momentum around Malnutrition Awareness Week and the resolution, and we've been very proud to partner with her over the years on this. And moving to other legislative items, you know, sometimes we forget that there are opportunities that we should always take advantage of at the start of a new administration. And that includes when cabinet and sub-cabinet individuals are nominated, they go through a confirmation hearing to then be approved and voted on by the full Senate, and then they begin their work. And so there are three positions in particular. Actually, we'll add there's a fourth one too, of course, the Secretary of Agriculture. Whose hearing is this week, actually, and the Secretary of Health and Human Services, whoever will run the Centers for Medicare and Medicaid Services, and whoever will be the administrator of the Administration for Community Living. Each of them have confirmation hearings, and we will be looking for those opportunities to have questions posed in these hearings to try and put some issues in front of them in the early stages that are, of course, remembered when they start their work. Because usually if a senator who confirms you ask a question about or express an interest in a topic, it's probably in your best interest to carry that with you as you start your work. So one of our jobs as advocates is to find those questions and try to get them submitted, and we intend to do that.
We also would note that there's been report language on medically tailored meals in the FY21 appropriations. And, you know, we're really interested in the concept of medically tailored meals. We know that some of you are, you know, in the Food is Medicine Coalition and work directly on this issue. So we'd love to talk to you about that. We're also very interested in prioritizing Congressman McGovern's medically tailored meals bill, assuming he reintroduces it.
And we look forward to working very closely again with the Academy of Nutrition and Dietetics on behalf of passage of the Medical Nutrition Therapy Act, which was introduced in the previous Congress. We think that at this time, especially in the time during the pandemic, we should be advancing medical nutrition therapy into as many relevant chronic diseases as possible. We also hope that it'll be something that can be utilized through telemedicine as we continue to expand our scope in telemedicine going forward. We also will be looking for either through the legislative process or the regulatory process to address the Welcome to Medicare exam and the annual wellness visit in Medicare to include questions on malnutrition. You know, one of the more interesting things about the Welcome to Medicare thing is it's really underutilized by a lot of older people. And some of it may be just, you know, human nature, not wanting to, you know, admit that you're in Medicare. But the way Medicare is a good program, so, you know, as one who's in Medicare, I'm very happy with it. And I think we should do is make sure that we are getting as much information from the individuals when they become Medicare eligible as possible. And certainly asking about their nutritional health and status is very important. And we could also help individuals should they be assessed as being having malnutrition at the time they take their wellness exam or their Welcome to Medicare visit. We also, related to that, would like to see in the Medicare new handbook that's given out to every single Medicare person at the beginning of the year some information about malnutrition and what Medicare is able to cover and what it might cover in the future. And also, there's been an explosion of growth in the Medicare Advantage programs in this country, in good measure because of the decision made a few years back by the Centers for Medicare and Medicaid Services to allow them to provide non-medical supplemental services, especially to the chronically ill, including a lot of services in nutrition. But we think for those plans that offer these nutrition-related services, there should be malnutrition materials available to the plan participants so they understand the full picture about nutrition and how to avoid malnutrition. So we'll be working closely on that topic this year.
We're also, again, wanting to explore the possibility of some form of congressional working group on older adult malnutrition, whether that's part of the House or Senate Hunger Caucus or some other form. We'd really like to see that happen, and we'll be talking to some folks about that. Also, never too soon to prepare for reauthorization, as we know from the Older Americans Act and the Farm Bill. Farm Bill is coming back up soon, so we would love to talk to other groups about what your initial plans are for that.
And in the area of further congressional activity, again, when you begin a new Congress, we're now in the 117th Congress, what you want to do is continue to cultivate the existing relationship you have with staff and members, and make new members, of which there are now at least 60 in the House, to make them aware of the issues around malnutrition. And, we always are looking to cultivate more champions in the House in particular. We're pleased that there's been a change in the leadership of the House Agriculture Committee, and we hope to work with that staff. And we know that Congresswoman DeLauro, who's been a longtime champion of nutrition issues, is now the chairman of the full Appropriations Committee in the House, but also remains her chair of the Labor, Health, and Human Services Subcommittee, and we'll work with all new members of the Appropriations Committee as well, again, for the purpose of developing relationships that can be used when the time comes for action on legislation. We also will look for possible and relevant committee or subcommittee activities in both the House and the Senate to either testify in person or submit written testimony. There are certain hearings that are very regular in the course of a year where we like to participate either directly or through written testimony. We also believe that the writing and sharing op-eds and journal articles and other things that may get published under our names, we should disseminate and share them with key staff on the House and the Senate. So that sometimes gets a lot more attention just a standard email asking for a meeting. And then, of course, in the environment that we're in, and it brings back to me a story that occurred a couple of years ago, we know how important stories are for advocacy. The more local, the better. And a major article was written one time in the Philadelphia Inquirer, where this enterprising reporter decided that he would, basically follow an individual who had been very successful in the entertainment business at one point, and went on some hard times. And one of the issues they was dealing with was malnutrition. And he did that story, and then he reached out and talked to a number of us about things that were going on in Washington that could be of help. But it was about that local story that got the media interested, and oftentimes congressional activities follow media interest. And then moving to other regulatory items that we expect to work on. In the near future, and I say this with confidence, that we will have a new National Resource Center on Nutrition and Aging under the auspices of the Administration for Community Living. And we are anxiously awaiting the release or the approval of whoever's going to run that center, and then have our Defeat Malnutrition Today be some kind of a working partner or have some working relationship with the center as a means of making sure that malnutrition gets the proper attention in the Resource Center in the years that it works going forward.
We're also working on the new dietary guidelines and their future, focus on older adults in the next iteration. So we're going to continue to look for opportunities to influence that process. We're also, along with several of you all I know, participating in the Federal Nutrition Research Initiative that's been started. So we're very interested in supporting nutrition research, as the name might imply. We're also, interested in some of the advocacy that's been happening for a White House conference on health and nutrition. So there's quite a bit happening here, and we're very excited. We also hope to continue to work with Administration for Community Living partners. National Nutrition Month is next month, and we'll be working with the Academy on that. ACL is holding a National Senior Nutrition Program Month, celebrating senior nutrition programs. So we'll be working with ACL on that, Older Americans Month, and Malnutrition Awareness Week.
I want to go back to the point about the White House Conference on Food and Nutrition. It's been since 1969. It was the last one of those that was held, and I think there's a growing sense that the issues that were discussed back then are still relevant today, maybe more so. And when you factor in the relationship with nutrition and health, we think, and we hope that we get some others to join us, we think it's time to have those issues raised in the kind of a forum that only a White House conference can do. We also expect to strengthen relationships and connections with other federal agencies and departments who have a role in activity in nutrition, Centers for Disease Control, the National Institute of Health, the National Institute on Aging, National Institute of the Substance Abuse Mental Health Agency of Health and Human Services, and others. And again, the same process that we use working with the Hill, we would work with federal agencies, which is sharing op-eds and journal articles, and developing relationships and just keeping the issue in front of them going forward.
Yeah, and on that note, I would say, obviously we are not the only ones in this coalition who write op-eds or journal articles, et cetera. If you are not sending those to us, please start doing so. We would like to share everyone's work with key staff in Congress and the administration. We're also planning to release this month, excitingly, an updated state legislative toolkit, which is our toolkit for state legislators. What we are planning to follow up with later this year is a state toolkit for advocates, because the original legislative toolkit is actually geared toward legislators. And we're hoping to follow that up with a federal legislator toolkit and one for folks advocating for policy at the federal level. So lots of toolkits hopefully happening this year.
And in the slides that will be kept up on our website and available to you, we're also going to put in a map of state activities that are going on the legislative front around malnutrition that we put together near the end of last year. So you can see some states are forming commissions on malnutrition. Some have Malnutrition Awareness Day or week recognized through a proclamation and so on. We are hoping to have more of that activity take place this year, and we hope our state legislative toolkit, which has been referenced actually by a number of state legislators over time, can lead to greater activity on the part of states. So on a wrap-up, I guess the most important thing we want to communicate today is that this is a coalition. Okay, and by the nature of coalitions, getting input from members on things like an agenda. Did we miss something? Could we do something more in certain areas? What are you particularly interested in that we're working on, where you can help us? It's all about interactivity. And the best coalitions, and we're familiar with coalitions, and we know that when there's input from members, the quality of the work of the coalition is better. The outreach to members of Congress is better when you can cite who's in your coalition. So we're asking this year that because if you're on the coalition, obviously you have an interest in the topic, that you plan to spend some time working with us this year. Be in contact with us as much as you can, and if there are questions or if you have comments on something, or you find something in an article, or you find something in a local paper, wherever it may be, or if you get an inquiry from a congressional officer or a federal agencies, that we can help with questions or comments, please let us know. We are looking forward to having another productive year. I think there's a lot on the table this year for us to work on. And, continue to look at our website. We have that wonderful name of defeatmalnutrition.today, which, is still unique among websites. And, and our email is there as well. And so I think with that, we would now see if there are questions that have been submitted to the chat box.
Comments. I've been responding to some of you, but one comment in particular that I thought was really interesting is there any work being done on supporting oral nutrition supplements to diagnose malnourished patients? There's been a little bit of movement on that. I can follow up with you further. There's a lot of discussion about that.
Yeah, and I think there probably will be more as more information comes out about the effectiveness of oral nutrition supplements for older adults in particular. It's always been a borderline issue with respect to the Older Americans Act because a number of the existing nutrition programs utilize oral nutrition supplements, and so we'll have to continue to see what develops over the course of the year.
Does anyone else have any questions, comments, concerns that they'd like to share? If not, we can give you back 20 or 30 minutes, which would be fantastic for everyone, I'm sure.
And we hope that if it doesn't come to you in this juncture, if you have questions or comments you wish to give afterwards through email or whatever, please feel free.
Oh, yes. Types of communication we'd like. We want to hear if you're talking about us. If you're mentioning us and showing infographics in your webinars, we'd love to hear about that. It's something. I mean, not only do we want to know that our name is being used, but we want to know what you're doing out in the field. That's the bigger part of it. So yes, please share anything and everything. We are not picky.
Yeah, and we're very proud of the materials that we produced that are cited in the course of different presentations. And so, by all means, let us know, and we'll be grateful for that information.
If no one has anything else, we can go ahead and wrap up. I wanted to set aside an hour just in case we had a huge conversation breakout, but it looks like the chat is being pretty quiet. Oh, this is something that we can discuss. What the Medical Nutrition Therapy Act covers. That's something that I don't know all of the conditions off the top of my head, but I know there are some great fact sheets out there about that. Send me an email, and I can send you over some of the fact sheets from the Academy of Nutrition and Dietetics in particular. If a state is forming a work group about malnutrition using our materials, yes, absolutely, we want to know about that. We do track state work, so we didn't talk about it a whole lot in our presentation today. We're very interested to know what's going on in the states and would love to know. Are the medically tailored meals covering pureed meals? That is something I don't know. If anyone from the Academy is on the line, I would love to know if you have any idea if medically tailored meals cover pureed meals, or if anyone from community servings or other organizations that work on this topic. If you're not on the line, we can get you an answer. Just send me an email, please. All right, I think that about wraps it up. So thank you all so much for participating in the coalition, participating in today's discussion. We really appreciate it, and we really appreciate you. So thank you, and I'm going to close the webinar out.